There are a couple of people visiting us tonight, and I'm going to start with our first keynote speaker. Zoe Andalcio has been on the Balm before. His topic is the value of community and connection in recovery. And before I read his bio to you, I want to remind everyone that we will save our questions till the second hour. So we'll have our two keynotes, our two interview panelists in the first hour, and in the second hour, the panel will discuss the topics with each other, and then we will open it for Q&A. Because we want families, whether they're part of the Balm or visitors, to have complete and total privacy when we put these up in the public eye, which they will be. We do not reveal your names if you ask a question, and we don't show your face. You'll notice that there's a Q&A panel on the bottom of your screen where you can put your questions and answers. And again, we will begin answering them in the second hour after and part of the panel discussion. So without further ado, I'd like to tell you a little bit about Zoe, and then he will tell us about his view of community and connection in recovery. Zoe Andalcio is a licensed mental health counselor in the state of Massachusetts with 14 years of experience. He's currently the director of integrated dual diagnosis treatment at Ellenhorn, a private program for assertive community treatment with 3 locations in the US in Boston, New York, and LA. Zoe has been trained in several evidence-based approaches to dual diagnosis treatment. He's a community-based therapist with a passion for working with clients in the community. He's worked with many clients in diverse settings, from homeless shelters and correctional facilities to community clinics and hospitals. He's trained in psychological first aid, harm reduction methods, open dialogue, motivational interviewing, and MBT, mentalization-based treatment. Zoe has served as a psychiatric crisis clinician in a hospital emergency room, providing psychological evaluations. His involvement in public health actually started in high school with his contributions on the first Boston Teen Health Report, a report designed and written by teens for teens and focused on the health indicators pertinent to teens, something which it continues to be a great concern in our country. In addition, he was a research fellow at the Institute on Urban Health while a graduate student at Northeastern University. And prior to coming to Ellenhorn, he worked for the City of Boston's Public Health Department, the oldest public health department in the United States. His clinical intellectual pursuits include reading and researching about public health care disparities, mental health gaps in communities, community-based interventions for addictions, and global interventions to promote mental health. Welcome, Zoe, and please take it away.
Good evening. Thank you so much, Beverly, for that introduction. It is a pleasure to be here tonight with you guys. And it's a pleasure to kind of witness, Beverly, your program, BOMB, as a very safe space for people to have really tough and challenging conversations. And I'm hoping today that I can share a little bit of some of the experiences I've had working with folks who are struggling with both mental health and addiction issues. Today, I really want to kind of ground our conversation in speaking a bit about the importance of language. I'm going to just note that, when I talk about people who use substances, I never say things like a person's an addict, and talk about people in a way that is not generally speaking about a person who looks like everybody else. That kind of language that came out of a lot of the treatment world is very stigmatizing. And so in order to create safety, like this is a safe space, we have to also include language that is inclusive, right? So I'm going to ground that. And then the other thing is, and I always say this, is that I understand that people, travel many roads to get to a point where we're here tonight. And so I just want to acknowledge that whatever space you come in, I am grateful that you're here. I'm thankful that you're here. So those are just some acknowledgements before I get started. So I work for, as Beverly says, for a private PAC program. And one of the questions I get asked often is, your program is really good and all, but what about people who can't afford this program? What about people who maybe are, residing not in a metropolitan city where your program is, and there's less resources? What about those folks? So today, I'm hoping that I want to talk about basically removing sort of the professional gatekeepers of information and talking about how to empower people, families, communities, to essentially get at the same thing that we do for work. And so what I want to do is I want to kind of look at the literature and what the literature says about recovery treatment. So there's three main areas I'm going to talk a bit about. But before I get to those areas, I want to just mention a little bit of what the literature says. So what the literature says is that folks who have both mental illness and addiction issues are at higher risk for several things. They're at higher risk for hospitalization. They're at higher risk for housing instability. They're at higher risk for legal consequences. There are many parts of folks who have this sort of co-occurring disorder or occupy this space that, many risk factors. And so we're talking about a population that is extremely vulnerable. Yet we're talking about a population that for many are not getting access to the proper treatment or to the proper support. There's many reasons for that. Part of the reason is our managed healthcare system. And the other part of the reason is that there's a lot of stigma associated with folks who are suffering from these various ailments. And I would say that lastly, about another reason that's really important is that people think about recovery in certain silos. They think about it either in terms of the addiction silo or the psychiatric silo, but most people are not understanding recovery in a sense of it's actually hitting multiple factors. There's a social factor, there's a cultural factor, there's all these different factors. And so in efforts to address recovery, we really have to I want you guys to think about three things. Before I get started with that, I do want to say, the other thing that literature says is that out of all the sort of modalities out there to help people, there is one common factor that's a better indicator of treatment success than any other factor. And that factor is the therapeutic alliance. Can this person build a relationship with you in order for the work to grow? So knowing that fact, the therapeutic alliance, and knowing the fact that there are all these ways in which the treatment is inaccessible, I want to now address sort of three things that folks can think about when you're thinking about supporting somebody who's in recovery. The first thing is safety. Safety in the sense of safety for the person who is providing support, but also safety for the person who needs the support. So I think it's important to mention when you're thinking about safety or talking about safety, there should be a discussion about boundaries. This is the simple idea of letting somebody know what you can and you cannot do. And telling them why. So understanding your limitations as somebody who is being a support or helper. The other thing about safety that's important is being non-judgmental. One of the important elements of the work that I do is I have a very harm reduction lens. And so to have a harm reduction lens, you have to have some sort of understanding that drug use or impulsive behavior is part of human behavior. And so coming at it with this idea that, people who use substances is not a sort of, what should I say? It's not a unconventional thing. A lot of people use substances. Not everybody has problematic use with substances, but a lot of people use substances. So coming at it in a very non-judgmental way, and with that non-judgmental way, being very curious about their experiences. Interesting enough, what the science says is that the same apparatus and system in the brain that controls reward pathways, and that system is the limbic system, is also the same important system in the brain that influences curiosity. So this is something that's important to understand because oftentimes when you're talking with people who are in the throes of addiction, their curiosity of thinking about other relationships with other things also gets affected. So it's very important that as the person who's supporting them, that you also take a very curious stance to see what this experience is like, knowing that their curiosity may be impacted by, by what's going on in their brain. The other thing I want to say in terms of creating safety is in your efforts to want to help, it's very important not to try to control an action by repeating a pattern of behavior. So in other words, if it's very easy for, I think, a lot of people to get into the dynamic of some people call enabling because they can't really control a certain thing. So I like to say, instead of enabling, just be honest with what you're unable to actually do. And so that's a very important thing in terms of, trying to create some safety. The other thing I want to say, and by the way, everything I say around safety should be done in a very compassionate sort of lens. This very curious, very compassionate lens, but also a lens that says, hey, this is where my limits are. These are where my boundaries are. And these are the ways that I could be helpful. The other thing that I've learned in my work is that, you're going to meet people at various different stages of their sort of recovery. So that means meeting people who are still using, or meeting people who are, maybe not compliant on medication, or are still having psychiatric symptoms, or maybe are very ambivalent about change, or just uninterested in change. And what I've learned over time that's really important is being able to offer support, and being able to give access to the services to people who use substances, regardless of where they are on that spectrum. And so this idea of connecting, regardless of where they're at, becomes really, really important. If you can't find ways to connect, oftentimes what you're trying to do is actually injurious to them. So one of the ways to try to connect is try to create a community of support. Oftentimes folks who use substances are very isolated and ostracized. So we want to do the opposite of that. We want to say, is there somebody in the community that this person can talk to, or this person can connect with? And how can I include them in sort of this support network? The other thing is you want to look for entry points of collaboration with the person who uses substances, and not coercion. You don't want to get into this place where you're coercing somebody into a certain behavior or a certain thing. You want to look for places where you guys can actually collaborate, given your own abilities. And then the other thing I would say is that, like I mentioned before, using language. I mean, language is based on a shared culture oftentimes. So using language with the person you're helping that is not stigmatizing, that is honoring their experiences, and that is really inclusive. So if you could create a safe environment, if you can create access to support for them, regardless of where they're at, and you can use language that is not stigmatizing, then you're kind of on your way. This is the thing. This is the issue with coercion, is that when you try to get somebody to do something that you want to do, naturally we have this thing called a writing reflex, and that writing reflex will do the opposite of what you're trying to get the person to do. And so we have to be very careful about that too, when we get into that territory of trying to get someone to do something. And the last thing I want to say is just the other way of sort of creating an environment or a community for people who use substances to be hopeful about change is understanding change itself, understanding how change happens. Change happens in very small steps along the way, small successes. This idea of not forcing the action, not having curiosity for change, all those things is going to hinder the work. So understanding that is understanding that you're not looking for overnight successes. You're not looking for complete demonstrations of change. You're looking for someone who is gradually over time integrating and incorporating new ways of thinking. They're getting flexible in their thinking, and they're being a little bit more curious about change. But they're being curious about change because you have a curious stance about their experience, and that you're coming at them with a very non-judgmental stance. So a lot of what we do in the work that I do is embodying all of those things. And I think really those things are very foundational. You can use whatever modalities, you can access whatever resources you have, but if you don't have these foundational ways of having a client feel connected, feeling safe, and helping them understand the sort of pathways to change and sort of the pace of change and all these other things, it's going to make the work incredibly difficult. I want to just end by saying, there's no easy fixes to this work. I think when you're talking about recovery, you're talking about so many different dimensions of a person and so many different dimensions of a community and of a society. And so whatever you are trying to help, you want to make sure that you don't become sort of narrow focused on one, and that you help the client, or the loved one, find a place, find a role, find a community to connect to. And then with that inclusion and with that sense of purpose and that role, the client over time will find healthier relationships to their behaviors and healthy relationships to substances and things like that. So that's just a sort of a brief discussion of some of the things that I found doing this work. So thank you very much.
That's so beautiful, Zoe. Thank you so much. And it's so balmy, so very balmy. This is the new languaging of recovery. It's the new way of understanding, that we are all human beings and someone isn't less than because they struggle with a mental health or use disorder. Thank you for bringing this up so beautifully in the clinical realm and sharing your views with us.